I was on dialysis for 4.5 years. Now, the closest thing I can describe dialysis to is as the living death. And now that I've been transplanted, it's literally like crossing from death to life. That is why I strongly believe that we should pass the End Kidney Deaths Act. The End Kidney Deaths Act is a tax credit that will be paid out to people who donate their kidneys to a stranger. It will save 100,000 lives over 10 years because we will deliver many people from a certain death on dialysis and kidney failure towards the promise of life, liberty, and pursuit of happiness.
The single best thing we can do for all Americans who are dying on the kidney wait list is to end the kidney shortage itself. With the End Kidney Deaths Act, we can end the era of 25 Americans dying every single day while waiting for a kidney. The kidney shortage means that half of the 90,000 Americans on the kidney wait list die while waiting. Many are reduced to begging and pleading with those in their communities for a kidney. We cannot allow this to continue. Every time a person moves from dialysis to transplant, the taxpayer saves roughly $500,000 over that patient's lifetime. Americans should not have to beg for kidneys any more than they should have to beg for insulin. In every other area of medicine, we ensure an adequate supply of medications. We do not ask patients to crowdsource chemotherapy or plead for antibiotics. We should not accept scarcity when the solution exists. We've heard that some have concerns about low-income Americans donating kidneys to strangers and receiving a tax credit. Here is the reality. Low-income Americans are 3 times more likely to die from the kidney shortage because health outcomes are correlated with income. If an American of any income level is willing to undertake the time-consuming, demanding labor of donating a kidney to save the life of someone they have never met, that is a patriotic act of public service, and it deserves recognition. When someone donates a kidney to a stranger, they perform an act of public service equivalent to a compensated firefighter rescuing someone they don't know from a burning building. The only difference is speed. One act is immediate, the other unfolds over time. Both save a life. We compensate people for difficult, essential work every day. We do not rely on unpaid benevolence to staff our hospitals, produce our medicines, or protect our communities. If living donation were working, we would not see 25 years of stagnation in donor numbers. If the system were ethical, people would not die waiting. It is time to fix the broken system. Congress has the solution. Americans support it. Doctors support it. Let's pass the End Kidney Deaths Act and finally end the kidney shortage.